Thank you for joining us again today. My name is Cynthia Kelly. I'm the Executive Director here at the Gluten Intolerance Group. This is the second part in a two-part series from Gretchen Kreizenbeck on skin clues related to gluten intolerance and celiac disease. There's a lot to cover. If you received an email from us today, you have the recording from yesterday's session already, and we will make this one available to you as well. Gretchen, take it away.
Hi, everyone. Thanks for joining us today for part two. Yesterday, we reviewed that I shared several of my dermatology cases that ultimately led to the diagnosis of celiac disease or gluten sensitivity. We learned that these two conditions are a spectrum and sometimes very difficult to diagnose. We saw the many phases of celiac in patients with alopecia areata, so that's patches of sudden hair loss that can actually extend across the entire scalp to the rest of the body. Patients with rosacea, so that's a red face with pimples, sensitive skin. Those with psoriasis, so that is often red patches or plaques that can have a white micaceous scale, often on elbows, knees, sometimes scalp, ears, and even the butt. And others with diffuse itch and severe, horrible itch, itchy bumps that can often even ultimately be diagnosed as dermatitis herpetiformis, a very specific skin condition that ultimately, if diagnosed with a skin biopsy, is actually good enough to also diagnose celiac disease. As a reminder, celiac is an autoimmune condition in which our body's immune system is reacting abnormally by attacking cells in the small intestine, as well as other parts of the body, only when gluten is ingested. But it can affect all of our organ systems. The longer this condition is missed, or the longer a patient is exposed to gluten, the higher the risk is of getting, sometimes more permanent, other autoimmune different conditions. I also shared that celiac disease is not only seen in those with European descent, but it is actually found just as prevalently in India, the Middle East, and North Africa. In fact, the highest rates are actually found in Africa, so the Western Sahara. Those rates can actually be 5.6%, a study showed us, versus the US and European more common average of 1%. Many studies, actually even one in Italy, suggested that celiac is still underdiagnosed by as much as 80%. Today, I will share with you two cases that highlight the importance of early diagnosis, as well as the importance of a lifelong adherence to a gluten-free diet. We'll briefly review treatment and, of course, follow-up. Let's jump in. So who's responsible for diagnosing celiac? I'm a board-certified dermatologist. Of course, many of us went to medical school or other, professional schools to understand our unique subsets of health. Sometimes we think about the gastrointestinal doctors or the primary care doctors, pediatricians to help us diagnose celiac, because sometimes in the more classic cases that we were taught about celiac, these kids have a short stature or failure to thrive. But like I've been sharing with you, I've met many adults, young and older adults, who actually have demonstrated celiac. And so I would argue that dermatologists, as well as other specialists, psychologists, psychiatrists, dentists, so sometimes many cavities can be seen, so not a great enamel to the teeth, or gingival bleeding with, again, that scurvy case that I shared with you yesterday, with this malabsorption that we often get sometimes with celiac or other conditions that are similar. So again, it can be very hard to diagnose, many signs, many symptoms, including other autoimmune conditions, or again, these kind of other things that can run along with celiac. So I'm going to jump right in here to the two cases I want to share with you today. So this first gentleman was is a 61-year-old male who really was, honest and shared with me that he had been through a lot of things, especially as a kid, as a young adult, a lot of behavioral issues, mental illness. But really all this started when he was about 5 years old, with these horribly itchy bumps that really were across his entire body. He later, in his teens, we'll go through the case specifically, but developed hair loss, severe swelling all over, myxedema, which was eventually associated with thyroid disease, severe fatigue, and just chronic pain. So even when he was young, 5 years old, he was just this itchy kid. That was actually part of his nickname. He actually described his itchy bumps as being more of a classic eczema appearance, so across flexural folds, so arms and legs. And he kind of described that as making him miserable and, admitted to kind of having some trouble at school. He was eventually labeled kind of the bad kid and put in special education. He came from a low socioeconomic class and really, kind of had some struggles growing up. Eventually was given a bipolar diagnosis. Looking at his family history, there was other mental illness in the family, including his dad with very severe depression. He was a war veteran, so there may have been some other, situational things, but his dad really struggled with depression and actually contemplated suicide at multiple times. So going back to our patient, later on, around age 10, he started to develop hair loss. So in fact, this was ultimately diagnosed as alopecia areata, but it continued to get more severe. In fact, it was one of the most severe types of that autoimmune skin condition that turned into alopecia totalis when he lost all of his scalp hair, turning him bald at age 14, again, growing up in the public school system, and this was many decades ago, really kind of, giving him kind of a hard time, getting through school and being made fun of by the other kids, things like that. And eventually it turned into alopecia universalis, where he lost his eyebrows, eyelashes, and body hair. Okay. So, this kind of stuff happening to a kid is severe. A lot of these skin conditions we need to take very seriously, and hair loss we need to take extremely seriously, affecting quality of life and mental illness, whether one begets the other, but, again, kind of coexisting sometimes with what we've discussed today, celiac. So he admitted this led to a significant addiction to drugs and alcohol, even at an early age. So later on in his life, around early 20s, that itch and those itchy bumps just stopped. Instead, he had other symptoms. He became swollen all over. So this was eventually diagnosed as myxedema. This was severe thyroid disease. Later, he developed severe depression. He eventually had debilitating panic attacks. He did continue to have some abdominal pain, but again, just, describing his history, he really didn't see that as kind of the center of all the things going on, but eventually diagnosed with GERD, which again, we often see in these individuals. Later, he was put on multiple psychiatric medications, but again, nothing was really working. The typical medicines for depression, for bipolar, for, all of these, panic attacks, all these really, difficult things that he was going through. Again, we hear this pattern, nothing is working. We saw that yesterday with some of the skin disease that I was trying to treat. So he self-described, becoming a shell of himself and just really, having difficulty in life. Amazingly, he was still functional. He was able, he was in his 20s. He was still able to work, I think at that time, some manual labor jobs, eventually went into IT and computers. But at that time, just exhausted, pain all over, started to develop hives, then dermatographism, which often goes along with these chronic or acute hives or urticaria. So dermatographism literally means, writing on the skin. And what it is if you scratch the skin in a patient with hives or urticaria, it often puffs up and you can kind of, again, write your name or write, create hives by scratching the skin. So that's something we look for when we're diagnosing someone with hives. He was later diagnosed with fibromyalgia, again, chronic pain, muscle aches. Again, looking at his family history and siblings now, his younger sister started to develop similar stories. Again, patches of hair loss, alopecia areata. She was eventually treated for depression and again, even very serious depression with similar suicide ideation like they had in their father. This is a different patient. Again, this patient is 60 years old. He did not have pictures, again, old-fashioned printed pictures from decades ago when he was a kid. This was actually a young person who came into my clinic recently describing itchy bumps, sometimes grouped, again, thinking about that dermatitis herpetiformis. So itchy bumps that more typically are going to be seen on the elbows and knees, but just like this patient was describing, just kind of arms and legs, or my other patients, itchy all over. So this patient, again, summarizing, he has a lot of things going on, but really, itchy when he was a kid, itchy bumps, behavioral, mental health issues, really significant, whether, called bipolar disease, depression, panic attacks, but really kind of went into this, again, self-described, his own words, hellish, nightmarish period of his life, ages 24 to 32. He was no longer able to complete physical labor. He started to, again, take other more stronger psychiatric medications, even chronic pain medications. Again, that stomach pain got to be more significant. Eventually, he was seen by a GI physician. University of Iowa physicians did an endoscopy. They suggested replacing his esophageal valve because his GERD and other symptoms were so significant. In fact, they did do an intestinal biopsy. Like we learned yesterday, endoscopy is the best test to diagnose celiac disease. It is our gold standard. But unfortunately, gold standards are still not always the best at solving problems. Again, evidence-based medicine, while it is wonderful in ways, we still have to think for ourselves and be smart about, thinking through these conditions. In fact, I think if you go back, so he did eventually go back and look himself at the pathology results from this endoscopy. And the pathologist did comment on the villi, those little projections that are in the small intestine that start to get blunted, shortened, and flattened when we have celiac disease and early gluten sensitivity. But they just thought it wasn't enough. Okay. And so again, this is how things can be missed, is that it's amazing how sick people can be. And the pathology or the staining of the slide or even those blood tests that we reviewed yesterday, they often are not positive or just not positive enough to meet that threshold that I would argue is still a little too high. So unfortunately, it was missed again, even though he was so very sick at that time. I think this took us maybe into the 90s or so, where the internet was kind of just exploding. Again, he was kind of interested in IT work, sort of a computer guy. He started to notice that these listservs were being created where he was, I think within a university, and somehow somebody, or again, through computer searches, somebody had kind of mentioned, hey, these different things that are going on, maybe you want to join this celiac listserv group, just like we have Dr. Google and other things nowadays that, are not always correct, but sometimes can really help us. So he decided he would eat nothing but ground beef patties for a month, basically an elimination diet, then slowly added a few things back in, like rice. Rice does not contain gluten. It is a grain or a starch, but it is does not have gluten, excuse me. Gluten is typically found in wheat, rye, and barley, so they are grains, but again, are not in other starches like potatoes, rice, and other things, other grains, other things like quinoa. So within a few days to a week, like I've seen typically in my other patients, he started to feel different, like unbelievably different and better, like a different human being. So when he was telling me his life story, he was tearful, happy and excited to tell me kind of how much he had been through and how he had turned his life around. He's a successful IT, really kind of boss or manager at a very prominent company, has been there for over 20 years now. And again, really wanted this, his story shared with everyone. And really, pointed out some interesting things that, he really thought that maybe we should start screening, for people for celiac disease at prisons and even mental health institutions. He really kind of, again, said himself, I was struggling so much, I could have ended up there. So I think that's really telling. And his story is a powerful one if we listen to it. Again, going back, unfortunately, we as MDs, we missed that he did have some villus blunting, and he should have been diagnosed with celiac a little bit earlier or even decades earlier. But again, he was missed for, over 30 years. He diagnosed himself ultimately. So he really classically did have dermatitis herpetiformis, maybe a slightly atypical distribution, but like I've shared, I've only maybe seen one case that's a typical dermatitis herpetiformis. He was diagnosed with bipolar disease, depression. I think he even endorsed suicide ideation at one point, and that strong family history. He did have alopecia universalis, which is the most severe type of alopecia areata. He had severe hypothyroidism. He had hives or urticaria, and even fibromyalgia. When he went gluten-free, many of these conditions melted away. And again, I think he did seek treatment for many of them, but ultimately on the gluten-free diet, many of these conditions self-corrected and resolved. The only two that did not, and like we shared yesterday, the later a patient is diagnosed or the longer a patient is eating gluten for the majority of their life, or again, even after diagnosis, if they go back to eating gluten at one point, but the longer they're exposed to gluten, the more likely they are to develop other second, third, fourth, fifth, sixth autoimmune separate conditions. And again, once those conditions are started, they are often separate conditions, and they do not always resolve on their own with a gluten-free diet. So don't get overwhelmed with this. I just wanted to share it that, again, there's so many different ways to diagnose celiac, even though, I think if you officially look in many of our textbooks, it will just say, best test is an endoscopy, which carries risk, which carries cost. A patient is put to sleep. That gastrointestinal physician has to take the right sample, the right place. In many of the studies where they're looking, they actually take 6 separate biopsies because, again, it can be a patchy disease. We talked about blood work last week, yesterday. We'll review that a little bit today. But this again kind of tells you how sometimes we can still get there. We can see malabsorption. We can see that, patients have some very specific symptoms sometimes, but again, over 30% of them are completely asymptomatic. Again, no even skin disease, besides no gastrointestinal symptoms. So again, this is a very difficult diagnosis to make, but I think when we're working together and we're all working on educating ourselves, like you all are here today, I think we're going to make some progress. So my final case in our series was an 81-year-old female that I met over the last few months. And she, walked in the door and I kind of thought, oh, I've got this. She's itchy. I see itchy patients every day. Looked for the usual culprits like we talked about yesterday. No new medicines, no scabies, no other common culprits. She was itchy across kind of upper back, lower back, upper buttock, very itchy in her scalp up here. You can see where I took one of the biopsies here. Maybe a little bit arms and legs, kind of these pink bumps. Didn't quite look urticarial to me at the time. Sometimes cholinergic urticaria can be individual pink papules like this, but not a great wheel and flare. But, at the end of the day, maybe, a dermatitis or again, hives. So when she walked in with her past medical history, again, living a long life of 81 years, I looked at this pattern, past medical history, and I thought I had this all figured out. I said, I am sure you're gluten sensitive, or probably, at this point in your life, we could prove that you have celiac disease with an endoscopy. Of course, she had a GI physician. She had endoscopies before. Again, no one had said that they had seen celiac, but unless we're really looking, I find that it is often missed, even when we're looking for it. So I was really convinced that if she just followed a gluten-free diet, she'd get better. Or again, like we've talked about, maybe, dermatitis herpetiformis. I'm going to take those special biopsies and I'm going to prove that's what's going on. Okay. Looking at her family history, I also find this very telling when one, or here she had 2 family members who they often will describe, quote, dying of stomach or gut cancer. So not colon cancer, but again, it's often kind of other, stomach or gut cancer. And we're going to get into that in detail in a few minutes. But again, her list of medications, which kind of say, oh yeah, she has muscle ache, she has pain, she has stomach pain, GERD, chronic pain, maybe some, depression, anxiety on some other medicines as well. Again, kind of a classic patient to walk in who, sometimes will be gluten sensitive. So I threw everything at her. I used all the usual treatments. Again, like we learned yesterday, this is when, when these patients are just not getting better, you're using all the standard of care treatments like I would, as a board certified dermatologist, and she was just not getting better. So I did all the usual tests as well. So a typical skin biopsy, you can see the results here. This is kind of nonspecific. Unfortunately, when we get these back and it says clinical correlation is essential, that kind of means they're not really sure and they didn't see a whole lot. And so the dermatologist should figure it out. And they did point out that maybe this kind of sparse pattern can be seen with hives, and kind of like, I had shared with you, maybe it looked a little bit like hives. We also have to think about, new medications and lots of other reasons why people are itchy. So like I said, I was getting pretty sure of myself that I had her all figured out and that I was going to diagnose dermatitis herpetiformis. But this test came back as negative. So again, that's a different separate skin biopsy with very specific staining immunofluorescence where they didn't see anything. And we did go over yesterday how sometimes, we don't see anything, and people try a gluten-free diet, and if they get better, that's very meaningful. I did the usual tests. So again, these are those good tests that we'd like to order when we're thinking about celiac disease. That's a very specific Quest panel that we can share with you again at the end. But this stands for transglutaminase, again, IgA and IgG, so tissue transglutaminase. And then these are typically the deaminated is a little bit better of that gliadin test. Again, IgG. Oh, I apologize. That should say IgA. We want to measure the total IgA. And this is a more expensive specialty test called endomysial antibody. But again, amazingly, she was all negative. Okay. So here we are. So that is that celiac disease diagnostic panel. This was added on. I added it on again, thinking I had it all figured out. But as I'm alluding to, I was wrong. So I did refer her also to an allergist. There's a great medication we have besides oral antihistamines, which we had tried. We had titrated up. She had failed those as well. We made her a little better, but she really wasn't much better. I had asked her to stop using some different things on her skin, as we often do. This was a kind of fibromyalgia pain patch that she liked to keep using. I did ask her to stop several times. Again, she wasn't just itchy where she was applying it, but again, we did kind of prove that she was allergic to that, and that was maybe part of the problem. But ultimately, she did stop using that. Again, wonderful patient. She was motivated to try lots of different things. Again, really frustrated. Itch can drive people crazy. It is horrible. Pain is horrible, but itch makes you pretty miserable also. And she was motivated to try a gluten-free diet. Okay, so she did. She felt better. Overall, she had more energy. She didn't have as many, or, I don't want to say zero, but, really a lot of her gastrointestinal symptoms, pain and the IBS and maybe a little bit of the GERD. A lot of that stuff got better. She did feel better. She did feel different, but the itch was still there. Okay. This picture is a better picture, again, from a nice dermatology website. And this is the more classic form of hives where there's kind of this wheel and then flare of that kind of redness there. So kind of going back over her, maybe the skin biopsy showed hives, but it wasn't very specific. We did a bunch of testing for celiac. We did find allergic contact dermatitis. We're giving her all the usual things, and she's not getting better. So what do? Well, in dermatology and in other areas of medicine, we kind of have to start fishing for some other things. And sometimes we kind of have to even go fishing for cancer when you're not getting better, especially with itch. So I ordered a lot of other good, again, even other autoimmune conditions as well, kind of fishing. And unfortunately, or fortunately, we did find an early diagnosis, stage 1, non-Hodgkin's lymphoma. So good news that we found it so early. She actually is doing very well. She's getting chemo. She's going to beat it. She's going to fix it. The type of cancer that she has is actually not aggressive, and she'll beat it easily. So overall, good news. But this case really shares with you the importance, whether, related to celiac or not. We'll get into how this ties to celiac, but it's important to keep looking. When patients are not getting better, that means our job is not done, and we have to keep looking. And unfortunately, besides celiac, there are other autoimmune conditions and other things like cancer that when people are not getting better with these kind of non-specific symptoms and itch, we have to keep looking. So this showed on her SPEP, that's kind of a favorite test of mine, at the end of the day when we just can't figure out what's going on. So this was a really kind letter. This was actually how I found out that she had cancer. Fortunately or unfortunately, again, she was very, very thankful. She did have to undergo chemo and undergo many tests, but she was very thankful that we figured it out, and we figured it out early. Okay. And then I like to highlight this part at the bottom because, again, even though going gluten-free did not fix everything, just like in many of us, it will not solve every single symptom and every problem that we have. It is amazing how it makes us feel better, and I'm going to get into how important it is actually for our overall health. Again, this patient, it was a little late going gluten-free. She did end up with this non-Hodgkin's lymphoma, which is found more commonly in patients with celiac and non-celiac gluten sensitivity, or not quite diagnosed celiac. And again, for these patients who have a sensitivity to gluten, or sometimes these positive tests, the treatment, it sounds really simple. It sounds really easy. It's quick to tell patients, oh, you just have to eat gluten-free. But it's not that easy. As many of us know, this takes work, and it is kind of this lifelong sentence of anything that touches the lips or goes, inside, these areas inside the mouth, it has to be gluten-free. I'd even argue lipstick and other things that touch the mouth. So why is that so important? Okay, of course, some patients, they feel better. Most patients, they feel better and they notice a difference, and they have less gas and more energy and less stiffness. And sometimes, their skin problems go away. So a lot of patients say, well, I just cheat once in a while, or, once in a while I have that special donut, even though they have gluten-free almost everything. So again, they can find those alternatives, even though sometimes they're different. They don't always taste quite as good. I would argue cheating is not okay. We all live our own lives, and I believe in patient autonomy, and patient they can make their own choices. But I think you need to at least share this information with your patients, not scare them to death. But I think it's important to be aware of why we need to stay gluten-free. Many decades ago, when, celiac has been around for a long, long time, but maybe 50 years ago, when there were the banana babies, where they just feed them bananas because they weren't, gaining weight, they weren't doing well. But when they took out gluten, again, an elimination type of diet, and just fed them bananas, then they gained weight, they did better, they grew, they were normal kids. And then ultimately doctors said, well, you can go back to eating a regular diet because now you're better. They found that didn't work out so well. Many of those patients ended up with non-Hodgkin's lymphoma, so cancer, okay? Because again, this is an autoimmune condition where the immune system is confused, and it's, attacking various parts of the body, specifically the gut, that leads to malabsorption. But this is found commonly in multiple studies. And in fact, the older a patient is when they are diagnosed with celiac, you can see here my patients on today's talk were older, the higher their risk is of getting this type of lymphoma. So again, I highlight that we really have to do our best being gluten-free. Of course, patients are glutens here and there. Those things happen. It is not the end of the world. They will not get cancer with one, gluten exposure. But this just kind of stresses the point that we do need to really encourage them to be as best they can gluten-free for the rest of their life. So I know that sounds scary and that sounds overwhelming, but I want to share with you the good part of that is that there are some neat studies out there that actually show there's a protective effect. Again, there's positive in this, glass half full, half empty, where they looked at patients who were eating gluten-free, and again, full on, diagnosed celiac disease, dermatitis herpetiformis patients, again, with positive biopsies, again, clearly celiac disease patients who then developed lymphoma. All of those lymphomas in this study from the 90s in dermatology, all of those cancers occurred in patients in which that skin disease, dermatitis herpetiformis, had been controlled with other medications. So dapsone is a medicine that we sometimes use. But those were patients who were either not following a gluten-free diet or had just started following a gluten-free diet for a very small amount of time, so less than 5 years. Okay? So it actually goes further to kind of say, when we kind of look at this a different way. So again, other studies have actually shown that strictly following the gluten-free diet will actually lower celiac's risk of gut lymphoma or that non-Hodgkin's lymphoma. Those are different types of lymphoma, but again, kind of grouped into the same category. So a study showed after following a gluten-free diet for over 5 years, celiacs, and I would argue probably those in the gluten sensitivity spectrum, no longer had that overall higher risk of lymphoma. In fact, they had a lower risk of lymphoma compared to the general population at that time. And that's tremendous. I mean, that speaks volumes if you ask me. That was kind of a neat study that looked at either as well colon cancer risk, kind of some other things of gastrointestinal tract, and then even just, patients who are not celiac, not gluten intolerant, if they ate or avoided gluten, if that would lower their risk for cancer. And they actually found that that did not. So again, it's very specific to if you have celiac disease or again, the sensitivity, which we can figure out by, following a gluten-free diet and seeing how you feel, seeing how symptoms, if some symptoms go away. But I think that's really exciting that by following a gluten-free diet, again, for those with celiac, we lowered the risk of cancer, and it actually was lower than the general population. All right, so how are they going to be gluten-free? Again, easy for me in a 30-second blurb to say, well, you just have to be gluten-free. Well, you have to give them tools. I'll share all those websites again at the end of the talk today. They're on all of these wonderful websites as well. Lots of books in the library, but ultimately the best thing to do is also refer them to a dietitian, okay? These well-trained individuals are going to go through all the things that can trip us up about being gluten-free, how sometimes it's in tea and barley and drinks and obviously beer, but in additives in food, even sometimes medications and vitamins we take. And that's not meant to scare everybody, but it's a process. It's a learning process to learn. But what's really cool is even if you haven't figured out everything out yet and you're really cutting back on the gluten, but really trying to be gluten-free, even though you make mistakes at the first few weeks to months to years, those things like anxiety, brain fog, even that irritability that can go along with low B12. But patients feel better. They feel like different people within days to weeks. Again, a lot of things get better. Not everything gets better or goes away, and not as immediately. So sometimes we have to treat other things. That's why, again, I think it is very important to refer to different specialists. Yesterday, people, were inquiring about other sensitivities. Unfortunately, once we become gluten-free, sometimes those other sensitivities or allergies or specific things that bother us when we do have additional or concomitant IBS, we still notice that when we eat those things, we can still have, problems or other symptoms. In fact, many of us are all, I would argue all humans are kind of allergic or sensitive to dairy and casein and lactose intolerant. Again, drinking another species, milk for a lifetime, when we normally just drink milk as babies and infants, typically bothers most of our systems. And of course, we watch for all of these other things that can be seen that sometimes show up later, but the earlier patients start eating gluten-free, usually the better off they are ultimately as far as their general health goes. So working with the dietitian, but again, primary care or taking ownership ourselves, whatever specialty we are. So even for myself in dermatology, I will order several of these blood tests like we shared the other day. That's actually how I would diagnose some of my patients with hair loss. Again, vitamin D, really specific test there, best one to order, the hydroxy version. And then again, checking for osteoporosis, that's commonly missed as well. Very, very commonly runs with celiac and that malabsorption. So doing a baseline DEXA scan is important. Again, lots of us can order that. Very easy to order and, share with the patient the results. Vitamin D, again, and then K2 specifically are very important to help the bones. Sometimes weight-based but safe exercise can be very healthy and help build stronger muscles and stronger bones. Calcium has never really been proven to help with osteoporosis. Just wanted to point that out gently. Again, going back to a little bit evidence-based medicine. And then just as we're ending here, just a couple of minutes over, I apologize. I did point out how many celiacs, gluten-sensitive patients, and just humans have other things going on. And, a lot of these things can be hard to, manage. Some need separate treatments. Some get better naturally being gluten-free, but really you need to support your patients in all these different areas. Not that every patient needs to referral to all these different people, because that's overwhelming also. But just, keep your eyes open for diabetes. Of course, those other autoimmune, rheumatoid arthritis types of things, and skin conditions like we talked about, and other gut conditions. So SIBO is one that's commonly found in celiacs when they've had it for so long, that does need separate treatment, often by GI. Also at the bottom, I want to highlight, consider these vaccinations. At first, celiacs are really kind of immunosuppressed because of the malabsorption and low vitamins. Once everything gets better, I'm curious about the studies and if there will be new studies on this, but, one of the ways to make the diagnosis is when patients do not develop a titer or a response to antibodies to hepatitis B when they get vaccinated for it. So I'm kind of curious, if we go back and revaccinate, if they then can become, immune to hepatitis, or develop a healthy response to that. These are my references, and these are the patient-centered, or again, great references for us to even go to as medical professionals. Great information for patients as well. Even basic things, how to go gluten-free, which sounds basic, but again is a lot harder than you think. And then how to think about these nutrient deficiencies. Some really great resources online as well. And then getting to some of those dermatology resources if you want to look at a few more pictures. Thank you again to everyone in the gluten intolerance group that helped put this together. Thank you to my patients, my colleagues, my friends, everyone who kind of helped, get this presentation ready and share pictures and sharing their life stories. Thank you.
Thank you. Taylor, do we have any questions?
We do. Yep. Thank you, Dr. Kreizenbeck. Okay, so we have one unanswered question from yesterday that I'd like to start off with, and that is, well, and you slightly mentioned it under treatments, but I'm just going to read the question. Once on a gluten-free diet that is working for about 5 to 6 years, could other foods begin to bother you because of a food allergy, such as in the carb line, although no gluten intake?
Great. So absolutely, we can have other things go on. And while that sometimes, can be overwhelming, I think it's just important to recognize that, we're learning things every day. There are some really neat tests out there that help with whether this is diagnosed as IBS, or again, what kind of sensitivity you're talking about. But if it's still kind of a gut sensitivity, stomach aches, cramping, bloating, things like that. Again, a dermatologist, not me, totally unrelated to me, but I think was struggling, personally and in their family, created this skin patch test where they actually, we have other patch testing like I discussed here, where we can figure out allergies to things that come in contact with our skin. But this is different. This is actually a really cool skin patch test where they're actually putting different food groups kind of on the skin. And then we measure the skin, we look at the reaction of the skin to see if that is actually causing a problem in the gut. And so it's not the typical, IgE allergic reaction, anaphylaxis allergy to different foods that, again, has increased in incidence and other people have. This is very different. This is more of that intolerance, and again, not exactly celiac disease, but in that category of a very, very specific food problems that people might have. So, I did blame dairy, as many of us probably should just go dairy-free as well. But some of us, for example, have a specific allergy to quinoa, or again, like, this person has stated, other starches, other grains. So you don't have to necessarily take out all grains, but sometimes it is a very specific food that is still bothering you.
Okay, great. And we've got another question here from Virginia Morgan. She's curious to know if your notes will be available to print. She's found this seminar to be profound and very helpful for skin problems and celiac disease.
So the slides themselves, is that the idea? I would be happy to share them. In fact, maybe Cynthia, you can speak to what we were also putting together, just a nice little infogram that highlights some things, but I'd be happy to share them.
Absolutely. We will be sending out the presentation as an audio. We can also make it a video, and we can provide it as a script, so you can see it that way as well. When we send out the post-event email. It will include a number of resources for you, including a great infographic for your office, just to remind you what you should be looking for, what tests to run, other resources that you could also give to your patients.
Wonderful. Okay, we've got two more questions. Suzanne has a question here that says, I recently read that for dermatitis herpetiformis biopsy, the skin adjacent to the lesion is what has to be biopsied. Is that correct?
Yes, very good. So in all of our textbooks, we as dermatologists, we know that it has to be peri-lesional. And so you're exactly right. So in my picture, I'm going to see if I can go back to that. The circles, the blue circles are how I document where I'm taking a biopsy. So I actually circled normal skin that was next to where that patient was having those bubbles, vesicles that were bubbling up. Again, this was not his skin, but I think it is there. So, arms and legs are shown here. And so this one, I guess, is a close-up. So that's normal skin, and peri is just nearby the lesion, so perilesional. And it's a direct immunofluorescence stain, so it's a slightly more costly stain in the pathology lab or dermatopathology lab. And they see, little granules in a very specific pattern. It's how we diagnose blistering conditions as well. I have found that, unfortunately, either based on where I have been biopsying, again, I've gone back and made sure I'm doing this correctly, because I find that it often is not positive. In fact, in this patient, it was not positive. In my case that I highlighted yesterday, that I really think was kind of a form of dermatitis herpetiformis, or again, I just see these itchy patients and some with itchy bumps in that pattern. That we often can diagnose celiac in other ways, or at least gluten sensitivity, but unfortunately that DIF for me is not often positive. The one case that I really remember being positive in the last 14 years, at least after residency, was a guy who was literally itchy all over and scratching, sort of bumps, but just itchy all over. And his was positive, but that was it.
Okay, thank you. Last question here is for middle-aged women with mood, digestive, and skin disturbances, how can we tell if it's perimenopause or wheat intolerance or celiac? She says, or they say, is there at least, or is there a test to tell the difference? And what do I say to my doctor to get the appropriate test?
Yeah. Great question, because I think, menopause and then perimenopause, which I think is 10 years, surrounding even almost, 20 before or after, it can be a long period of time. I think that can be slightly different, even though, I would argue, sweating or night sweats, I think that can sometimes be seen with celiac disease. But we do think, classically think of that, weight gain, hot flashes, which again can kind of be that facial flushing. Some patients develop rosacea as well during that time. You are right that a lot of these non-specific brain fog, forgetfulness sort of things can overlap. And sometimes we have two things going on. I think that's the other part of it. Not that everybody is celiac, and I guess only women go through menopause. But I'm not a menopause expert. I am a woman. I know that there are sometimes hormonal tests that the gynecologist will check to kind of prove that you've hit menopause or after menopause. But in my understanding, there are not great blood tests that really prove you're too much in the middle of it before that. So it really kind of, this again is going back to the art of medicine and maybe finding a menopausal specialist, which I do know, there are some out there. You want somebody who listens to you and talks to you. I think you could pull apart some of the symptoms. You asked very smartly, is there a blood test? So I said, no, there's not one for menopause, or at least early perimenopause. It's only kind of after the fact. And for celiac, the blood tests, I can go to that slide for a minute. There are blood tests for celiac disease. I just want to remind you, though, that for the endoscopy, which is that best test that, again, can miss it, but is the best test, or those blood tests, someone has to be eating gluten, and a lot of gluten. So a lot of times doctors will tell you to have a gluten challenge. So here they are. So this panel, this Quest celiac disease diagnostic panel. And so very specifically, again, you can go anywhere to have these done, but these are shortened, but it's transglutaminase. these two, IgA and IgG, and then gliadin, but very specifically this deaminated, I think I'm saying that right, gliadin. This is supposed to be gliadin. And again, that's IgA, IgG. So this is a little mistyped there. It should be IgA and IgG. So, you can't ask your doctor just for a general celiac test. I will tell you, not all of the MDs will order these more special tests that sometimes can suggest celiac a little bit more. A lot of MDs, again, were trained to read those tests. This was more from yesterday's lecture, so maybe you could go and, review that or check that if you missed yesterday. But I go into detail how, that threshold is not always met sometimes when we're first starting to get celiac. Sometimes we just have a little bump in those numbers, but again, a classically trained evidence-based doctor will look at that and say, nope, you don't have celiac. Again, to me, that does not rule it out. So at that point, after you've been tested, you could try a 100% gluten-free diet for 2 to 3 months. And again, I think that will be telling. Again, if you're still having symptoms, I think sometimes those perimenopausal symptoms, those usually need kind of hormonal treatments to get better. Okay.
We actually have about 5 more questions that just popped up.
Great.
Great. Let's go with it. Okay.
Yep.
So let's see. Go with this one. What can be done about hair loss and rosacea in a senior? Are there products to use?
There are always products to use. I hate to say this, but, I would see a board certified dermatologist. That's why we do lots of years of training. I think if the question is what is there over the counter wise, again, you deserve a workup, you deserve to be looked at. And there are very specific prescription products that are best for rosacea, really safe topical ones. But again, prescription products that are best. Sometimes patients will do well with an over the counter azelaic acid. Again, I prescribe one that's a little stronger, but sometimes you can use a 10% product. I like the one from The Ordinary. Again, I'm not getting paid by The Ordinary, but I have used their products. That's between $10 and $20 at, most of those kind of skincare stores. 10% azelaic acid, but you have to put that on after a good, thick, heavy moisturizer because, again, rosacea is sensitive skin. So that's a good place to start. Make sure you're not using, significant foaming cleansers. Sometimes even a gentle soap like Dove bar soap that suds up can sometimes even be too aggressive for our skin when we have rosacea. So sometimes you almost just wash with water, or again, at nighttime to get things off, you can look for a Cetaphil cleanser, really gentle, non-foaming things. La Roche-Posay is another nice brand for many rosacea patients. Hair loss gets more complicated, like we were discussing. Again, I often order blood work for patients, but there is over-the-counter Rogaine. So that generic is called minoxidil. That's much more affordable. That 5% is very safe for women as long as we're not getting pregnant. You don't want to let your pets lick it off your head at night because it can be toxic to small animals in large quantities. I know that's weird, but it has happened to patients before. Otherwise, extremely safe, but you kind of have to use it ongoing forever. So I think I answered that question.
Okay. Next question is, I have probable celiac, no biopsy test. Last time they tried allergy testing, everything reacted, including water. So they said dermatographic skin,
Yep.
Can't do skin testing. Are blood tests the only other option?
Yeah, so I'm not an allergist, but in dermatology understanding, and I think the allergists would admit to this as well, blood testing for food sensitivities is classically not very good. So not very sensitive, not very specific. I think sometimes we can, highlight or, glean a little information from it. But I'd be a little careful, really looking at that too heavily. What I would try to do is, so a couple of things, antihistamines, first again, work with your doctor. But antihistamines are kind of, over the counter, very safe medicines. A lot of times when we're on those, or again, sometimes on that gluten-free diet after more time, so that might be part of this as well, that dermatographism and things will calm down. So you could go back and do that patch testing more accurately. There's debate of being on antihistamines and getting saying patch test if that's still accurate. In my book, you could still probably do that, even though in a perfect world, you wouldn't be on those. But I think keep working with the allergist and maybe even the dermatologist as well. And sometimes, they have to keep looking, not that it's other bad things, but sometimes with chronic hives, there are other things like mastocytosis and even, other things that can kind of give us those symptoms. So I think sometimes some of those additional tests are warranted with your physician. Okay. But keep working on it. And I give you encouragement. I give you hope.
Next question is, I developed a sensitivity to peppermint. That's toothpaste. Dentist said that both peppermint and cinnamon are irritants. I had thought I had dry mouth, but once I went to kid toothpaste, which was fruity, and the dry mouth resolved. So all kinds of sensitivities can turn up.
Yeah, that's exactly right. And, again, in dermatology land, we see that commonly, even the other chemical that's in, some of the fancy and whitening toothpaste. So SLS, sodium lauryl sulfate, which is kind of that sudsing agent that I said a lot of us with rosacea and other things are sensitive to, that can cause that dry mouth. So a lot of natural, so peppermint, cinnamon, even natural, good, healthy things. I even joke with people that poison ivy is natural. Again, we can be itchy or sensitive to different things. So, the other part of this is listen to your body. And, if your doctor or PA or, nurse practitioner is not listening to you and not helping you, then, keep advocating yourself in a kind way, but keep looking for answers elsewhere.
Okay, next question is, I think you said you would talk more about tests for celiac and tests for maintenance gluten-free checks.
Sure. So that's this slide blood work wise, again, not perfect, but this is that celiac disease diagnostic panel. So transglutaminase and anti-gliadins, those are the ones I recommend. That test also has total IgA or total immunoglobulin, because if patients do not make the standard immunoglobulin, then those tests will be falsely negative. Otherwise, we refer to gastroenterology so that an endoscopy can be done, where again they do a gut biopsy while a patient is asleep. They put kind of a tube down that patient's throat while they're comfortable and not feeling anything, and take a sample in a very, very specific part of the duodenum, and then sometimes they can find specific staining and specific patterns that show celiac disease. So those are kind of our best tests. Sometimes doctors, so we can actually retest, again, going back to this blood work. So sometimes they'll or do the endoscopy again to see if the pathology staining looks better, to see if the villi look healthier. But the other thing you can do is repeat blood work. So some of us think we're eating gluten-free, but sometimes it's still sneaking in there somehow, okay? So by retesting transglutaminase and gliadin, those are the best tests. We would still see a positive number if you're still getting gluten in some way. And so sometimes it is sneaking into the diet, and it's still, whether you have symptoms or not, because again, some people don't have any gut symptoms or any symptoms whatsoever that are attributed to celiac. And so that's a good way to test later on, besides the other tests that I shared about making sure all the vitamins are up to date. Okay. So a lot of us, have that malabsorption. And so you have to recheck these until they get to a normal level. Sorry to fly through everything here again. Too fast. You really want to make sure that people are no longer iron deficient, that their B12 is at a normal level, which means above 400. Again, a lot of these websites have that information for you. And again, I had a patient with low vitamin C, scurvy, that old-fashioned sailor diagnosis that, we kind of thought, oh, pellagra, all these things don't happen anymore. But they do. I see people with them in my regular suburban office all the time.
Okay, we have someone asking if you take Medicare.
I do. Yep. Pretty standard. Yep.
Great. And the last question is, while some specialists have an interest in celiac disease, is there a particular specialty that studies celiac in their residency?
Great question. So Celiac or that dermatitis herpetiformis was, maybe one lecture in dermatology residency, and dermatology residency is 3 separate years after an internal medicine 1 year internship, which is, those are those 4 years after medical school, which are also 4 years or 5 years, depending upon your research and other training. So unfortunately, dermatology, there is not much. This is all really my own special interest. Unfortunately, my family genetics as well. So self-interest, and then now kind of turning that to helping a lot of the patients that I see as well. Again, we kind of classically think of the GI doctors as being the celiac experts, sometimes those pathologists as well, that get sent the slides. There are specialty celiac centers, usually within, again, the gastrointestinal specialty. So that's internal medicine and then doing a fellowship in gastroenterology. I don't think I can speak to any more of that specific training because that's not what I did. But that would probably be the route that you go if you're young and you're looking to be a specialist.
Anything more, Taylor?
No, that's it.
All right. Dr. Kreizenbeck, thank you so much for the wonderful information you've provided over the last couple of days. For everyone attending, we will send out an email that will include links to both presentations and some additional handouts and resources for you. Please stay tuned for additional webinars in the future. Take a minute to answer that survey for us so that we can see what works best for you. Gretchen, again, thank you so much for all the information you've shared.
You're welcome. Thanks everyone for attending.